So we're going to talk about one of the easiest vital signs there is to actually measure, and that is going to be taking a temperature. As a CNA or patient care tech, it is important to check your patient's temperature, usually at least once per shift or more often if the temperature has been abnormal. Checking and recording a patient's temperature is just a basic nursing skill. If the temperature is too low or too high, it could be a sign of a serious health problem that needs medical attention. So, what is a fever? A fever is an increase in body temperature or hyperthermia. The most common cause of fever is an infection caused by germs such as bacteria or viruses. Other causes of fever may include heat exposure, cancer, autoimmune disorders, certain medications, or immunizations. Signs to monitor for when taking care of your patient include skin that feels hot to touch, flushed cheeks, which are red or pink in color, low energy level or not feeling well, chills, headache, and body aches. Don't forget that whenever you're taking a temperature, you can do so orally, under the armpit, or via the axillary area. You can also take a rectal temperature. It's just based on the environment in which you work. And for most adults, we are either going to have an oral temperature or a thermal temperature where we can actually scan the forehead. There's also measuring devices or tools that will allow you to take a temperature via the ear. According to the Cleveland Clinic, the average temperature for an adult is 97.8 degrees Fahrenheit up to 99.1 degrees Fahrenheit, or 36.5 degrees Celsius up to 37.3 degrees Celsius. If your facility is requiring you to document in Celsius, most of the times the electronic health record will automatically convert Fahrenheit to Celsius readings. All right, so let's talk about the equipment that's needed. In order for you to take a temperature, you would need a thermometer, and that's going to be based upon your place of employment. So most thermometers are going to be digital. If you have an oral/rectal thermometer, you will need a disposable probe cover. There's also covers for tympanic or ear thermometers. Cover is not usually required for a temporal or forehead thermometer. You'll also need alcohol wipes to clean the equipment, and gloves are needed for hygiene. Don't forget to wash your hands before and after taking a patient's temperature. So this is what we have today. We have a forehead scanner, and we also have a thermometer that has an oral probe. Whenever you are using a thermometer with an oral probe, your facilities may have one that has a blue tip or one that has a red tip. I want you to remember that red is for rectal. So do not use the red tip on your patient. It is going to be the one that has the blue tip. And the way that we keep this clean is that we're going to put a thermometer cover, a probe cover on top of it. And so we're going to insert it. And it says there, insert number 1. And then number 2, we peel back. And when we peel back, we will expose the covered thermometer. Whenever you're placing a thermometer under your patient's tongue, it goes in the front of the mouth, beneath the actual vein where the tongue is. You're going to press the on button, and this can take up to a minute in order to read. And whenever it has finished its measurement, you're going to hear a beep. So, Mrs. Loretta, is it okay if I take your oral temperature? Yes. Have you had anything to eat or drink? Yeah. Okay, awesome. And while that is actually doing this measurement, I do want to talk about the elderly population. So we'll say that a patient has a temperature, a fever, if their temperature is above 101 degrees Fahrenheit. But with your elderly patients, sometimes if their temperature goes above 2 degrees, their normal or their baseline, we say that they will have a fever. So if Mrs. Jenkins' temperature is only 97.8, but you come in today and it's 99.8, that would be an indicator that she may have an infectious process. Recheck the temperature after you change the environment in the room, such as maybe move a blanket, make sure she hasn't drank any coffee or anything. And if you recheck that temperature and it's still elevated, make sure you let your nurse be made aware. And Mrs. Loretta, I'm sorry it's taking so long, but it should be finished reading soon, okay? Mm-hmm. And so that's what you're waiting to hear. And so, Miss Loretta, your temperature is 97.8, which is normal for you. Right? Do you have any questions?
No, ma'am.
Remove your probe cover. Turn off your thermometer. If you have an alcohol swab, of course you can wipe it. And I know Miss Loretta personally, so I don't have on gloves. But in your facilities, especially if you're dealing with the mouth and oral secretions, make sure you've actually done proper hand hygiene and wear gloves when you're taking someone's temperature. So next, let's talk about the thermal reader. And so this one is really easy to use. It's just going to be where you press a button to turn the device on. You put it a few, maybe like an inch and a half away from your patient's forehead. It scans it and it determines the temperature. And it says 97.8. So that would be another way for you to take someone's temperature without using the probes and the probe covers. And it keeps the equipment a little bit cleaner. So I'll see you in a few moments. And that's when we'll talk about the pulse and respirations. All right, see you in the next video.